So his question was, what does my mom plan to do to fix the Affordable Care Act but not scrap it as her opponent wants to do? There are more than 20 million Americans who now have health care coverage because of the Affordable Care Act. Those are not statistics. Those are people's lives. And I think that often has gotten lost in the conversation about the Affordable Care Act. That being said, we know we do need to work on the affordable part of the Affordable Care Act, and we need to move from 91% health insurance coverage to 100% health insurance coverage. So my mom thinks we need to do a few things, just focused on the affordable part. My mom thinks, one, we need to finally do something that she first fought for back in 1993 when she worked really hard for universal health care coverage, and it didn't work out. But part of her original plan in 1993 was to empower Medicare to negotiate directly with drug companies. And that would help do two important things. One, it would help immediately dramatically lower drug costs for our seniors. And that's hugely important because for so many seniors, drug costs are by far not only the most expensive part of their health care bill every month, but the most expensive part of just their bills every month. But that would also be good for those of us not on Medicare yet. And I like to think I'm going to live long enough to be on Medicare. So for those of us not old enough to be on Medicare yet, we would also benefit because Medicare pricing is totally transparent. I mean, there's a hospital, just across the road. I don't know where my geography is. 2 hospitals, right, in this direction. And you can go online and you can see how much HHS, the Health and Human Services Department, kind of through Medicare is paying for kind of services and drugs in those hospitals. And since pricing is transparent, it would be really hard for the drug companies to charge those of us not on Medicare yet even 3 times what they would be charging someone on Medicare, much less kind of 30 or 300 times. So empowering Medicare to negotiate on behalf of our millions and millions and millions of Americans who are on Medicare is good for people on Medicare and those of us not on Medicare yet. The second thing she thinks that we have to do is to kind of pass through tax credits, real relief to help control premium costs and out-of-pocket expenses. And the third thing she thinks that we have to do is to enable people starting at 55 to be part of Medicare, so to lower the age for Medicare, and to introduce a public option in every state so that there's real competition. So we have to do all of that, and particularly